Hello, good day. My name is Elizabeth Pedersen, and I'm with Cook County Health. Thanks for joining us. If you need help with an appointment or have a medical question, please call our health system at 312-864-0200. Again, that number is 312-864-0200. My guest today is Dr. Gregory Hune, an infectious disease physician at Cook County Health and principal site investigator of several COVID trials. Welcome to the show, Dr. Hune.
Thank you, Elizabeth. Good morning, everyone.
Dr. Hune, thank you for joining us today. Tell us a little bit about what you do at Cook County Health.
So I'm with the Division of Infectious Diseases. I am an associate professor also with an affiliation at Rush University Medical Center. So what we do here in general actually is treat patients with infectious diseases, and that would be from viral diseases, bacterial diseases, fungal diseases, parasites. That's the general type of work that we do. What we've been now focused in on, certainly since the pandemic, has been COVID-19, and the work that I've been doing has been centered on some therapeutic trials. The first one was remdesivir, which we conducted at Stroger Hospital. And now we're looking at monoclonal antibody therapies for ambulatory patients or patients that are not hospitalized with more mild to moderate disease. And we're also doing some prevention as well with vaccine works among my other colleagues.
Excellent, thank you. How did you get interested in this area of expertise? Obviously, with the COVID pandemic, things are quite different, but how did you first become interested in infectious disease?
I would say that it would go back to even before I started medical school, when I was a recent graduate from my undergraduate degree, which was molecular biology. I worked in some labs. I guess you could say I was kind of a gene jock. I worked on the Human Genome Project. And then I hooked up with an NGO that invited me to work in Liberia in West Africa, actually in the lab. And during that time, this was 1990, there was a civil war that emerged. We created a blood bank within our hospital. I actually did rapid HIV testing and screening for my blood donors, and that was among community volunteers. And that really put me on the path, I think, toward a career focused on infectious diseases, focused on tropical health. I did earn a master's in public health in tropical medicine while I earned my medical degree at Tulane. I've worked among populations that have been perhaps disenfranchised from healthcare due to socioeconomic factors. So those health disparities have been magnified in the communities that I've worked in. That's been for the Navajo in Shiprock, New Mexico. I've also worked with the CDC as an epidemic intelligence service officer. So again, a public health outbreak investigator for 2 years when I was here with the Illinois Department of Public Health. And then I earned my advanced degree, you could say, in infectious diseases here at Cook County and at Rush, and joined the faculty in 2006. So I think my pathway was guided by my interest in these populations that have been on the fringe and have been underrepresented in healthcare, and I really enjoy the work that I here do with, among my patients and my colleagues in the research arena.
Yes, well, it sounds like with your background, now more than ever, it definitely has probably come in handy with the COVID pandemic. So I guess, what do you enjoy most about your job at Cook County Health? Especially, like, what is the joy you find, especially during the hard times that everyone's having with the COVID pandemic? What is it that you find joy in at your job right now?
Sure. Well, I mean, when I started here, it was really the patients that attracted me to this position. I really feel a bond, I think, with my patients, again, given my background. And then I can couple that actually more on a global level with some of the research that we're doing. So ultimately, the research that we do is for the benefit locally of our patients. So on a global level, we're creating drug discovery and development for these new therapeutics and prevention measures for COVID-19. But it really comes down to, who are the ones that are suffering the most, and the ones that I see really are the patients that I'm taking care of. And so when I'm able to talk to my patients and alleviate their fears and hopefully offer them hope with therapeutics or prevention for COVID-19, that's really the payoff. And that's what I enjoy doing, the side with the patient care that also has the derived benefit from the research that we do here.
Excellent. Thank you for sharing all of that with us. So now that fall's here, are we seeing any flu cases yet? And how is that going to intertwine with the COVID pandemic that we are currently facing, not just globally, but here locally in Cook County?
Yeah, Elizabeth, you're correct. Now that the fall season is here, we are on the lookout for flu. Fortunately, we have not had flu cases yet. We do start offering vaccines in September in order to get people ready for the flu. The reason why we're not seeing flu yet, it is still quite early. Oftentimes the flu does hit, let's say in November or December, and then it peaks in around January or February. It was not a severe flu season, how we can predict flu that would be here in the Northern Hemisphere during the Southern Hemisphere winter season. So the Southern Hemisphere winter season has now passed us. That was, again, during our spring and summer season. And because I think of the measures taken by many different countries to protect themselves against this global pandemic, COVID-19, by wearing their mask, by keeping their social distancing, by doing the hand hygiene, those are all measures that prevent flu as well. Flu is a respiratory virus. It is transmitted, again, by people that are coughing or sneezing or talking or laughing or singing. And so if you provide those spaces, that social distance, and then protect yourself with the mask and the hand hygiene, we've seen that flu globally did not reach the levels that we normally see in a regular seasonal flu time. And so we haven't seen it here yet. We hope, again, with our aggressive measures for flu vaccination and maintaining that overall, let's say, hygiene to protect ourselves, both with the mask, social distancing, and keeping our hands clean, that hopefully will keep the flu away to a great degree this year.
Great. Thanks for kind of speaking to that. I know we've heard a lot in the media about this twin-demic as far as the flu and COVID. Are you worried as an infectious disease expert that we will have a problem here in Cook County?
I think it's possible that we could have a problem. And so when you're dealing with two respiratory viruses at the same time, you just multiply and compound the complications that could happen, particularly from lung disease and pneumonia for patients that would get both the flu and COVID-19. There are some differences, however. The flu, many times the symptoms actually look similar. So with the cough, the fever, the chills, headache, body aches, fatigue, they can present similarly, both the flu and COVID-19. Key differences though, the flu usually kind of hits you right away. It really levels you really within the first day or two when you acquire the flu. And that's the point actually when you do want to seek out medical care, because there's actually therapeutics for the flu. There's antivirals that you can take that can minimize those types of symptoms. And by minimizing those symptoms, you can prevent transmission to others. The transmission to others actually occurs usually on the onset of symptoms for the flu and can continue on for about 7 days. A key point, a key difference for COVID-19 is that though some of those symptoms look similar, there's a potential unique feature by the loss of taste or smell with COVID-19. That's almost a cardinal feature. And you can actually be transmissible or contagious a couple days before that onset of symptoms. So it kind of complicates the picture of who's at risk for COVID-19. You really need to treat everybody around you as a potential spreader of COVID-19. And then the duration of transmission or contagiousness actually may go on for up to 10 days after the onset of symptoms for COVID-19, or even in those with severe cases that develop a deep pneumonia, that may develop heart problems, that may develop kidney problems. That type of contagiousness may go on for actually up to 20 days. So we are concerned about both viruses joining together and having more complications. But we hope, again, with our aggressive message to get vaccinated for flu, that we will not experience those types of twin-demic confrontations.
Excellent, thank you. So you touched a little bit on the symptoms being similar between the flu and COVID-19. You mentioned that the symptom of losing your sense of taste is one of the key differences between COVID and flu. Are there any other symptoms that people should look out for to differentiate between the flu and COVID? And should they, if they think they have either, quarantine themselves from their families?
Yeah, that's an important point. And so who's at risk for COVID and who's at risk for flu? We're actually all at risk. We actually do see more gastrointestinal symptoms of flu in younger children. So nausea, vomiting, diarrhea. We actually do see that in adults, but it's more common in children. Um, and those at greatest risk for flu and COVID would be those in the elderly populations. But importantly, also some of the comorbidities where we find more complications in those acquiring COVID-19 would be additionally those persons that are obese, those that have cardiovascular disease, chronic kidney disease, hypertension, immunosuppression conditions. And really the mortality rate is far greater in those persons, particularly in the elderly for COVID-19, about an 8 to 15% case fatality rate for COVID-19 versus far lower in seasonal flu, which is about less than 1%.
Okay, that's excellent. Thank you for sharing. What are kind of the best preventive measures to prevent both viruses for our viewers? What would you recommend?
Yeah, again, for sort of the personal protection, I would designate that as the trifecta, again, for masking. If we all were to wear masks, if we had, let's say, a national mask mandate, and we were all to wear masks in the open air spaces where we're in contact with people, and most importantly, in the closed indoor spaces, we could prevent almost 95% of transmission of COVID cases. And that transmission actually occurs far greater in the inside setting than on the outdoor setting, maybe about 19 to 20-fold higher, greater risk for COVID-19 transmitting indoors than outdoors. So masking is probably the preeminent type of protection that we can use ourselves to really bring down our risk for COVID. The second would be that social distancing. That is another reason why outdoors is a little bit safer than indoors, is because we're more socially distanced outdoors. My concern and the concern among the medical community, the public health community, is that when the winter time hits and the weather gets cooler, we're all going to be congregating more indoors. And so we still have to keep our social distance at least 6 feet away. The flu is mostly transmitted by droplets, so a little bit heavier particles, and usually falls off at that 6-foot point for transmission. COVID may have some airborne aerosolization, so may travel further and hang in the air a little bit for longer. And so again, that social distance is going to be very important. And then finally, the hand hygiene. Viruses get everywhere on our body. We get infected because they land either in our nose, our eyes, our mouth, and that's kind of part of the mucosal or the ear, nose, and throat or respiratory tract deeper. But we carry viruses on our hands. So if we use hand hygiene, use hand gel, alcohol gel, wash our hands frequently, that's also going to prevent both flu and COVID-19. And I would say, as I mentioned, I'll just throw a fourth one in there, since I mentioned where do both flu and COVID land, mostly on the face. So if we can avoid touching our face, again, that's kind of a hard habit to break for many of us, but that would be another measure that we can personally protect ourselves. Now, there's a flu shot, okay, for flu, and not yet for COVID. So a very important medical intervention that we can take would be the flu shot, and hopefully within the next few months, we're going to get that COVID-19 vaccine.
Excellent. So people should still get the flu shot even though we're in this global pandemic, correct?
Absolutely. The flu shot carries about a 40 to 60% protective rate. And even if you get the flu, then it does confer a measure of protection against severe influenza, the influenza that would put you in the hospital with pneumonia and requiring oxygen. So yes, absolutely, patients should get their flu shot. And hopefully we would expect some of the same features of protection within the first wave of the COVID-19 vaccines that may be available toward the end of the year or the beginning of next year.
One of the complaints that we hear a lot from people, I know when we're just out, they think that they can get sick from the flu shot. Is that actually true, Dr. Hume?
Elizabeth, thank you for bringing that up. That's a myth that I hear all the time. You cannot get sick from the flu shot. The flu shot does not give you the flu. The flu shot does not promote complications of other types of viral infections. When you get the flu shot, if you actually do get a reaction, and the reactions are usually mild, Most common would be a sore arm. Some people get a mild fever, maybe a headache. That's just a sign that your immune system is kicking in and generating those antibodies to protect you against the flu. But it actually does not give you the flu. That's the biggest myth, and that's one of the biggest challenges we have as medical providers and clinicians, to really make sure that our patients understand that and understand the importance of the flu shot and what the flu shot actually does, and as well as what it really does not do. And it does not give you the flu.
Excellent. Thank you for clarifying that. I know a lot that continues to happen even after years and years of discussing it with viewers. Where can people go to get a flu shot these days? Especially, everyone is kind of cooped up in their house, and they have a lot of anxieties about going to a hospital or even a health center. But where can people go to get the flu shot? Where is the best place?
Yeah, I mean, well, the flu shots are really ubiquitous, fortunately. We have enough supply to almost vaccinate everybody here in the United States. So they can go, again, to their local medical clinic. They can go to urgent care centers. They can go to pharmacies. Many of the pharmacies have been stocked with flu really right after Labor Day, and many of my patients get the flu shot at their pharmacies. You can come here certainly to our clinics in Cook County Health, public health clinics. So there's multiple areas to get the flu shots. The schools are primarily closed right now, so we're not offering school-based flu shots.
Okay. Thank you for sharing that with our viewers. Please make sure you go out and get your flu shot, everyone. Each year, the flu vaccine, how is that predicted? And every year, different, it's concocted with different courses of strains of the flu. Can you kind of speak to that a little bit?
Sure. So the flu shot actually has 4 different strains from 2 different types of viruses, influenza A and B. And each year, the seasonal flu shot undergoes slight changes based upon predictions from the previous flu season, primarily flu strains that have emerged in the East Asian countries. And usually we put our bets on those strains that would be circulating here in the Western countries, probably in February. And then we ramp up our manufacturing for those flu shots. It used to take place primarily in really chicken eggs. Now they're kind of grown up in more highly technological laboratories types of let's just say lab developments, and so we usually actually have an estimate of how bad the flu is going to be based upon the previous year, and then we look for a match for what's circulating then in humans, and then what's in the vaccine. So sometimes we have a pretty good match, and the flu shot can be protective up to, let's say, 75 to 80% of cases. Sometimes it's not. Maybe it's 20%. So we can say on average it's about 40 to 60% protective.
Okay, excellent. Thanks for clarifying that. So if someone does have flu symptoms, should they run to the ER, or what kind of is the protocol that you recommend for patients?
Yeah, if somebody has flu symptoms, I would say that it would be a good idea to alert their physician. There is antivirals that they can take that can make them feel better about 24 hours than they would if they were just to let the natural course go. So I do think in the beginning of flu season, I think it's a good idea to actually perhaps have a visit at a medical center, get tested, see if you actually do have the flu. I think it's going to be a good idea this year now, because we're not going to know if somebody has the flu versus if they have COVID-19. So it's going to be, I think, important to differentiate by testing, especially early on, whether somebody has the flu or somebody has COVID-19. So I would actually encourage patients who, if they think they have the flu, to reach out to their medical care provider and to see, one, if they should get tested, and two, would they be eligible for antiviral medications.
Okay, so patients don't need to come rushing into the ER if they think they have flu or COVID,
I
right?
don't think they need to go rushing in. I think that they should probably contact their provider. And I think that's also going to be important, especially if they have household members that may be in a vulnerable risk group, as we talked about, both for flu and COVID-19. We definitely want to make sure that if somebody is a potential carrier of flu or COVID-19, that we identify them and then that they can get the right treatment to protect against transmitting that type of virus to others around them.
Okay, excellent. So there has been a lot of talk in the media about vaccines for COVID-19. Can you kind of talk to us a little bit about where we are right now and what it's kind of looking as far as projections of when we might potentially get a vaccine?
It has been an amazing, breathtaking experience, I would say, with the development for COVID-19 vaccines. We started to understand the genomic code in January. Many different institutions right away got on the ball to develop the mix of proteins and even DNA material that are now emerging in vaccine technology, to put those vaccines together and actually start the initial safety phase 1 trials even as early as March. We have now then begun phase 3 trials, which are the licensing trials for these vaccines. These started again in May and then during the summer. And this is the launching point where we need tens of thousands of volunteers to get these vaccines in order to know, one, if they're going to be effective, and two, if they're going to be safe. And so the standard for vaccine development, and with Operation Warp Speed, we have multiple vaccines in phase 3 studies. We have 11 worldwide. We have 4 main studies here in the United States that have already enrolled tens of thousands of patients. And what the FDA has determined is that a vaccine would be licensed if it shows at least a 50% effectiveness level to protect against COVID-19. And we need at least 2 months after those patients are enrolled in the trials to observe them to see if the vaccine is going to be safe, at least 2 months after they receive the vaccine. Most of these vaccines are a 2-dose strategy, 3 to 4 weeks apart. There is one vaccine that's actually a 1-dose series, but many of these are new vaccines that have never been circulating actually among our armamentarium to prevent viral diseases. And so with the rapid development of very novel preventative measures with these vaccines, I really think that we do need to take a serious look at, one, are they going to be effective, and two, are they going to be safe? And so we would expect that we would have most of that information then perhaps by the end of this year or the beginning of next year.
Okay, so I know there's been a lot of also attention in the media about people wanting to come in to be part of these vaccine trials. Do people need to worry if they want to help out with these vaccine trials locally?
So I think that's important that we have all populations represented in these vaccines. Usually we take healthy persons first, and then we need to take a look at those that are more vulnerable. So those elderly patients, those with what we call comorbidities or cofactors that put them at risk for greater complications from COVID-19. And again, that would be the heart disease, lung disease, immunosuppressed conditions, diabetes, obesity. And so do patients need to be worried? Well, it's a phase 3 vaccine. These are phase 3 vaccine trials, and so they're very closely followed. And so we critically need this information for effectiveness and for safety. So far, there have not been too many signals that show that there may be what we would call toxicity or adverse events. There was a case in Britain with a individual who developed what's called a transverse myelitis or a central nervous system condition that followed one of the vaccines. And so the FDA is looking very closely at all the elements that went into that vaccine and all the events that transpired around that one individual. So should people be worried? I should say that people, if they enroll in these vaccine trials, they're under the care of medical professionals and they're closely monitored. And I would say that we actually do need to have these heroic volunteers really come and participate, not only perhaps for benefit for them, but really for benefit among all of us to defeat this pandemic.
Excellent. Thank you for clarifying that. That was great. We're wrapping up the show now, but do you have anything else you'd like to add for our viewers to help us with the flu and continuing on with the COVID-19 pandemic?
I would say that we've really seen, and you mentioned a twindemic between flu and COVID-19. We've had syndemics, so these clashing epidemics, I think, that have really been amplified here in the United States of, again, some of the factors of poverty that now have been really magnified in populations that are experiencing the greatest burden of COVID-19, especially among communities of color that represent the majority of infections of COVID-19. So I think we really all need to come together and through our sort of joint efforts, uh, uh, really understand that we're in the fight together. You've mentioned those volunteers for the vaccine studies. Yes, that we need representation from all these communities. We need to have awareness that once these therapeutics are available, that they should be offered to all of us. That we need greater access to healthcare overall to again beat back COVID-19. So I've actually myself, I've come to have a very healthy respect of the challenges that we have been confronted for COVID-19, but I've actually been very happy to see how we've all come together in our efforts to get to the other side of COVID-19. And I would expect that we would continue to have this esprit de corps among all of us as we move forward and hopefully expect to have the life that we've always enjoyed, hopefully as we move into at least next summer or toward the end of next year.
Excellent. Well, thank you so much for joining us today, Dr. Hune, and for kind of speaking to flu season and COVID-19. Never thought we would be here, but with professionals like you, we know we're going to get through this. So thank you so much.
All right. Thank you.
Again, viewers, if you need help with an appointment or have a medical question, please call our health system at 312-864-0200. Again, that number is 312-864-0200. And again, remember to get your flu shot, and thanks for joining us today.